Gertrude Children's Hospital. We are here today in Lamu County to launch Daktari Smart, which is a telemedicine program in partnership between Mpesa Foundation, Gertrude's Hospital Foundation, Gertrude Children's Hospital, and the counties of Lamu, Baringo, Samburu, and Homa Bay. And so this program is mainly to address a gap in healthcare delivery towards contributing to achieving universal health coverage. The requirements of universal health coverage, number one, is that all people in every part of the world should have equity in access to healthcare. They should get a good quality of healthcare. And number three, that they should not be bankrupt in the process of getting healthcare. So this project is to address specifically the needs of children who require specialized care. And we came up with this project because there are not adequate healthcare workers in the country, number one, generally. But number two, the number of specialists in the country is very low. And specifically when you come to pediatric care, this country has only about 700 pediatricians. Almost 60% of those are in the cities and towns of this country. So in many rural counties, you do not have specialists, general specialists in pediatric, but also specialists in pediatric subspecialties. So the way the program works is that it rides on ICT, that the few specialists that we have in Nairobi, and particularly for Gertrude Children's Hospital, will be able to provide specialized care to children who are referred from far off places away from Nairobi. So we first ran this pilot in Garissa County around 2 years ago, and it was very successful in partnership with DFID, and that was really a proof of concept to see whether it works. And once we figured out that it works, then the proposal was to roll it out in as many counties as possible. And in this first phase, which we're partnering with the Mpesa Foundation and Gertrude Children's Hospital Foundation, the Mpesa Foundation is putting in 167 million shillings. The Gertrude Children's Hospital is putting in 35 million shillings. And this will be a paid for service that children who are referred from those 6 counties that were in the first phase, the care will be paid for. The subspecialists will be available in Gertrude Children's Hospital in Muthaiga. And when the children are referred for subspecialist care, there'll be a booking process so that the subspecialist in Muthaiga doesn't have to travel to all those counties. They can use the telemedicine platform to provide specialized care. Now, this is not just teleconsulting or video conferencing. The platform has medical equipment that are attached to video conferencing. You have what we call an ECG machine, you have an ultrasound machine, you have an ECG machine, and you have what we call a demo camera and an otoscope. So those are all different types of equipment that then the doctor in Nairobi, the specialist at Gertrude Children's Hospital, can actually examine the child who is very far away as though the child was actually in the same room with them. So through that process, they're able to provide care, to prescribe treatment, to prescribe tests, and then the clinician who is locally in the facility will be able to then advise the parent and the child will get care. So through this program, we've already seen in the last 2 months close to 400 children, combining all those counties. In Lamu particularly, we have attended to 120 children, and we think the number will grow. The whole program in 3 years will attend to 32,000 children. And so after that, then we'll scale it up for all the counties, work with different partners so that every single county in this country will have the telemedicine program. So thank you, and God bless you.